So we're going to start off with a pretty easy one. Amoxicillin is prescribed as 150 milligrams 3 times daily for 10 days. So it seems as though the doctor has calculated the dosage already for us based on the child's weight. But we always want to re-verify the weight so that the pharmacist can go ahead and double check that the calculations were made appropriately. And we check the stability of the antibiotic before serving it. So we're going to look at this a bit more in detail. So if we look at the formats available to us, we have the 125 milligram per 5 ml format as well as the 250 milligram per 5 ml format. If we simplify these, that's what we get here. And it's written on the bottle that the stability is 14 days when refrigerated. And this is perfect because we know that we're going to be using the antibiotic only for 10 days. So we're going to go ahead and calculate the amount of antibiotic that we're going to be giving out in milliliters. So we know that the prescribed dose is 150 milligram 3 times daily for 10 days. So we want to figure out how much this is in milliliters. If we're to use this format here, 50 milligrams per mil, and we do some cross multiplication, we end up getting 3 milliliters that we're going to be giving the patient 3 times daily for 10 days total, which equals to 90 milliliters total. So I'm going to show you guys why I decided to pick this format here, the 50 milligram per mil, because if we were to go with the 25 milligram per mil format and we do the appropriate calculations, we find out that the total amount in milliliters that we're going to need to give the patient is actually 180 milliliters. So this means that we'd have to give 2 bottles, whereas when we use this format here, we only need to serve 1 bottle. So it's just more convenient this way. Here we have a new prescription for Clavulin. So here we see that the doctor has not done the calculations. Instead, he's given us the weight and the prescribed dosage. So we're going to go ahead and first of all check the formats that we have available. For Clavulin, in case you guys don't know, it's a combination of Amoxicillin and clavulanic acid. So this is why we have 2 different concentrations here. So Clavulin 400 is equal to 400 milligrams of Amoxicillin, 57 milligrams of clavulanic acid per 5 milliliters, and the format is 70 milliliters in total. So if we simplify this, we're only going to be referring to the concentration of Amoxicillin and not the concentration of clavulanic acid. So we're going to look at the concentration as 400 milligrams per 5 mils, which when we simplify it turns to be 80 milligrams per 1 mil. And on the bottle, we see that the stability is 7 days when reconstituted, whereas we're going to need to be using the antibiotic for 10 days in total. So we're going to have a problem here. If we're to serve 1 bottle, it's going to get expired before the patient completes the treatment. This is why we're going to have to serve 2 different services on 2 different days. It's not going to be on the same day that we're going to give the total medication. So first off, what we do is we try to figure out the weight in kilograms. Then we, like we've done before, calculate the milligrams that we're going to need per dose based on the child's weight. Now we do some cross multiplication. We get the amount in milliliters. And we see that the total milliliters that we're going to need is 168.7. 1 bottle contains 70 mils, so we're going to need to serve 3 bottles. How we're going to do this is in 2 separate services. So we're going to serve the 2 first bottles on day 1, and then we serve the last bottle 7 days later. Here we have a prescription for Bioxin, it's Clarithromycin. The concentration is 15 milligram per kilogram per day. We're going to serve it as twice daily for 10 days, and here we have the weight in kilograms. So the format is 105 mils, the concentration is 250 milligram per 5 mils. We simplify this into 50 milligram per mil. The stability is 14 days, so it's okay because we only need 10 days of treatment. So we're going to go ahead and calculate. We get the amount in milligrams again, and we do some cross multiplication to get the amount in mils. And we find out that we're going to be needing 36 mils of the antibiotic total. So what we're going to do is we're going to serve 1 bottle, which contains 105 mils. And the instructions we give out to the patient are to give the baby 1.8 ml twice daily for 10 days total.